medical capacity case 2 role play. Miss K, can you tell me the medical conditions that you have?
Well, I have a lot of back problems, diabetes. I also have high blood pressure.
Okay, so I'm going to go through a quick list of medical conditions, and can you just say yes or no if you have them?
Okay.
Breast cancer?
No.
High blood pressure?
Yes.
Thyroid problems?
I don't think so.
Any kidney problems?
No.
Diabetes?
Yes, I have diabetes.
Okay, chronic pain?
Yeah, the back is pretty bad.
Okay, and high cholesterol?
I think so. I think I take something for that.
Okay, great. Can you tell me what medications you take, speaking of medications?
Well, I take something for my heart. I think a baby aspirin, and for high blood pressure, I do my insulin, and then I have something for my nerves in my back. I'm forgetting the name of it right now, but it's supposed to help with that pain.
Okay. Do you know the name and the dose of your heart medication?
Well, it's for high blood pressure, but I don't remember the name. I think maybe like it starts with an L or an M. I'm not sure.
Okay, that's okay. And you mentioned that you take something for your nerves. What did you mean by that?
Oh, yeah. So, my nerves, so feeling, it's like for my mood.
Mm-hmm.
Yeah, I've been on it for a long time. I think it's called sertraline.
Okay, thank you. Yep. And you said you take a baby aspirin as well. What is that for?
That's for my blood. So they said I should take that for heart attacks.
Okay, great. Thanks for all that info. We talked about your back. You mentioned your back already. Can you tell me what's going on with your back pain?
Oh, wow. Well, I feel like it's been a long time I've been suffering. I have arthritis, and it,
Okay.
I take Tylenol when it's bad, but,
Okay, how often do you think you take Tylenol?
maybe like once or twice a week.
Okay, great. Okay, so I'm going to move on and ask you some specific questions about your diabetes, okay? Can you tell me what diabetes is?
Sugar in your blood.
Yes, exactly. So diabetes, when you have high blood sugar, maybe insulin resistance, or a lack of insulin. And Miss K, can you tell me when your blood sugar is low, high, or normal? How do you know?
I check my blood. I can kind of tell when I'm getting low because I feel kind of woozy, or I get like the sick feeling. I just feel kind of out of it.
Good. So you check your blood. About how many times a day do you do this?
Well, like usually before I eat or before bed. I would say like 2 or 3 times a day.
Okay. And can you tell me what levels tell you that you have a high, low, or normal blood pressure? What numbers are you looking for?
Well, for me, they say anything above 180 is what they say I should be worried about for high blood pressure. And I would say I'm usually around 180. I'm sometimes higher than that. And I think that's what, is the problem. Sometimes I'm in the 200s. And it just, I keep doing what they say, and it just keeps getting higher, and I'm taking my insulin, and I don't really seem to get it right.
Well, it's a tough thing to have to manage, but it sounds like your blood sugars are high. Do you ever get low blood sugar? You mentioned it. How do you know that you have low blood sugar?
Yeah, so sometimes I go from low to high, and I'll have low blood sugar in the nights or in the mornings. I can get low, usually maybe in the 70s last time. And that's when I start feeling woozy. When I have high, I don't feel any different. It's just that low blood sugar.
Yeah.
So it's kind of hard to know exactly what's going on.
Right, and you can't really tell when it's high.
Yeah,
Unless you test it.
Mm-hmm.
Do you know what a normal range is for blood sugar?
Well, let's see. Well, for me, like between like 80 and like 130, usually like is where they want me to be.
Mm-hmm. So that's the normal range. And what treatment do you take to manage the diabetes?
Oh, I do insulin.
Okay, and do you inject yourself daily?
Yeah, I do.
Okay. Your doctor voiced some concern with that treatment, with managing that insulin at home. It looks like you maybe missed some doses, and as you mentioned, your blood sugars have been getting higher over time, even with some adjustments.
Mm-hmm.
What do you think is going on? What sort of trouble have you been having at home taking your insulin?
Well, I just get so tired. I watch my grandson. He's 6, and it gets really stressful. I love him to death, but he never stops moving, and sometimes I get low, and sometimes I just don't have the energy to get up, or I know that I need to check it because it could be high, because I tend to run high after I eat, and I know I need to, but just sometimes I just don't have the energy to do it.
Yeah, it sounds like taking care of your grandson, although enjoyable, it's something that's also really stressful for you. And you may have had some low mood. These sorts of things can make taking your medications on time and just managing something like that a lot more difficult.
Yeah, I think it is. I have good days and they do good for a few days. But then I don't know what happens. It just kind of gets the better of me. Sometimes I just forget, like my mind is somewhere else, like the TV's on, or my grandson's running around, or I don't really know what happens. It's just sometimes my mind's just somewhere else.
So later on I will ask you some more about your thinking and memory, and we'll do some tests to see how that's doing. But for now I just want to stick to asking you about your diabetes care. Can you tell me one risk of diabetes if you're not managing it over the long term?
Well, my nerves, my neuropathy, I have that already in my fingers and in my toes. They feel tingly. I've also been told it can affect your eyes or your vision, but I don't have that.
Okay. Yep, those are both risks of diabetes over the long term. You're right. Do you believe that you have diabetes?
Oh, I know I do. I've had it for over 10 years.
Yeah, and you said earlier that you take insulin. Can you tell me how insulin is a benefit to you?
No, it controls my sugar.
True, yep. And any long-term benefit of continuing to take insulin?
Well, hopefully it will give me less neuropathy,
Okay.
or maybe make it better. I'm not sure.
Mm-hmm. Do you think that you'll continue to have diabetes?
Probably.
Okay. So let's discuss your treatment, your insulin, a little bit more. Can you tell me one risk or benefit of taking insulin for diabetes? Let's start with the risks. Are there any risks to taking insulin for your diabetes?
Well, I know sometimes I've taken it, I've had really low blood sugar later in the day, and so I'm thinking maybe it's making me have too low blood sugar.
Yep. Okay, so that can be one risk. What about a benefit of taking insulin?
Well, it's supposed to control my blood sugar.
Yeah.
So that's why I do it.
Mm-hmm. Good. And what would you decide to do to continue treating your diabetes? Would you want to stay on insulin? Would you want to try something different? Would you not want to treat your diabetes at all?
Well, I definitely have to treat it, but it would be nice maybe to not be on insulin if that was possible. but the doctor seems to not think that's possible for me, which is why I'm here. I really struggle with taking it all day.
Okay, great. Thanks for answering all those questions for me.
Mm-hmm.